Have you ever stood up from your chair and felt the room suddenly spin? Or maybe you've gripped the nearest wall, waiting for the dizziness to pass, telling yourself it's just one of those things that comes with age. What if we told you it is? According to the American Academy of Family Physicians, AAFP, orthostatic hypotension, the sudden drop in blood pressure that happens the moment you stand affects approximately 20% of all adults over the age of 60 living in the community. And in hospital wards, that number skyrockets to a staggering 68%. This isn't just dizziness. It is your body sending you a warning signal you cannot afford to ignore. After the age of 60, your body's ability to regulate blood pressure becomes progressively less reliable. The same cardiovascular system that quietly and efficiently kept you upright for decades begins to slow down its response time. And this delay can be quietly sabotaging your heart, your brain, and your independence right now, without you even realizing it. So here is what we want you to ask yourself today. Could this simple, dismissed sensation be an early warning of something far more serious? Could it be connected to the medication sitting on your nightstand? Could it be the very reason you're feeling mentally foggy, forgetful, or exhausted? Stay with us, because the answers might completely change how you see this symptom and what you choose to do about it. In this video, we are going to walk you through the real reasons why you feel dizzy when you stand up, breaking it down into the 7 most critical causes you need to know about. And here is the one thing that will surprise you most. Cause 2 is one that your own doctor may be accidentally triggering. You'll want to stay all the way to the end, because we are also going to give you a complete, step-by-step action plan to fix this, starting today. If you are new here, welcome. This channel is dedicated to giving you the clearest, most research-backed health information for living your best life after 60. Go ahead and hit that like button and subscribe so you never miss what's coming next. And drop your country in the comments right now. We love seeing just how global our community really is. All right, let's get into it. Habit 7. You're not drinking enough water. Let's start with something deceptively simple: dehydration. Now you probably know that staying hydrated is important, and you might think, I drink enough. But here's what most people over 60 don't realize. As we age, the body's thirst mechanism weakens significantly. You may not feel thirsty even when your body is already running low on fluid. Here, what that means for your blood pressure. Blood volume drops when you are dehydrated, and less blood volume means there is simply not enough circulating blood to keep pressure stable when you stand up. The result? That spinning, fatting, grab the nearest surface feeling the moment you get out of a chair. After age 60, the kidneys also become less efficient at conserving water. This means your body loses fluid faster and replaces it more slowly. The Cleveland Clinic confirms that dehydration is one of the primary and most correctable causes of orthostatic hypotension in older adults. Imagine this. It's a warm afternoon. You've been busy around the house. You sit down for a rest, then stand up to answer the door, and suddenly the edges of your vision go dark. Your heart pounds. You grab the door frame. That wasn't a strange episode. That was dehydration pulling the floor out from under your blood pressure. According to research published in the journal Orthostatic Hypotension in Older People, PMC, 2021, low blood volume from inadequate hydration is one of the top reversible triggers of orthostatic drops in the geriatric population. What to do? Aim for 2 to 2.5 liters of fluid daily. Use 500 ml water boluses, a large glass of water, when you wake up in the morning to give your body an immediate blood volume boost before you stand. And remember, don't wait until you feel thirsty. By then, you're already behind. This is one of the simplest changes you can make, and your circulation will feel the difference almost immediately. But the dangers don't stop there. Habit 6. Your meals are triggering a blood pressure crash. Ever feel dizzy or oddly sleepy after eating a meal? That's not your imagination. It's a real medical phenomenon called postprandial hypertension. Eating is essential, and a good meal is one of life's great pleasures. Nobody is suggesting you stop eating, but the way and timing of your meals could be silently triggering dangerous drops in your blood pressure every single day. When you eat, your body rushes blood to the gastrointestinal tract to help with digestion, actually doubling the blood flow to the intestines according to research from Merit Research Journals, 2023. In a healthy younger body, the nervous system compensates by tightening blood vessels elsewhere to keep overall pressure stable. In aging bodies, this compensation is sluggish or fails entirely. After 60, the baroreceptors, the pressure sensors in your arteries, respond more slowly. Insulin released after meals also acts as a vasodilator, further lowering blood pressure. The result: postprandial hypertension, defined as a drop of at least 20 mmHg in systolic blood pressure within 2 hours of a meal. You finish a big Sunday lunch. You push your chair back, stand up to help clear the table, and suddenly you feel a wave of dizziness so strong you have to sit right back down. Your family thinks you're just tired, but your blood pressure just fell off a cliff. According to a study published in PMC titled Postprandial Hypertension, an underreported silent killer in the aged, 2023, postprandial hypertension is associated with syncope, fainting, falls, and even transient ischemic attacks in older adults. What to do? Eat 5 to 6 smaller meals throughout the day instead of 2 to 3 large ones. Reduce refined carbohydrates and sugary foods, which spike insulin fastest. Avoid standing up immediately after eating, sit, or recline for at least 30 minutes after a meal. Drinking water before and during meals also helps slow gastric emptying and blunts the blood pressure drop. Simple meal restructuring can dramatically reduce your dizzy episodes. Your meal times don't need to become a medical ordeal, just a little smarter. But the dangers don't stop there. Habit 5. Your medications are working against you. This one is sensitive because we are talking about medications that were prescribed to help you. But the research is clear. Polypharmacy, the use of multiple medications at once, is arguably the single most important modifiable risk factor for orthostatic hypotension in older adults. If you are taking medication for blood pressure, heart disease, depression, or prostate problems, those prescriptions exist for good reason. We are not suggesting you stop taking them, but you have a right to understand how they interact with your body's ability to regulate blood pressure when you stand. Over 250 different medications are associated with orthostatic blood pressure drops, and the risk increases cumulatively with every additional drug you take. According to a systematic review published in PLOS Medicine, 2021, common culprits include diuretics furosemide, hydrochlorothiazide, alpha blockers used for both blood pressure and prostate doxazosin, tamsulosin, nitrates, beta blockers, ACE inhibitors, and antidepressants. Here is the finding that shocks many people. A 2025 study published in the British Journal of General Practice found that patients prescribed SSRIs, antidepressants like sertraline or citalopram, face a 4-fold increase in the risk of orthostatic hypotension in the first 28 days of treatment. This is the window of highest vulnerability for falls and fractures. You start a new antidepressant. 3 weeks later, you begin feeling dizzy every time you stand. You assume you're just under the weather, but what's actually happening is that the medication is actively suppressing your body's ability to keep blood pressure stable the moment gravity gets involved. According to the British Geriatric Society, BGS, Falls and Medication Guide, alpha-1 blockers like doxazosin are among the highest-risk medications for falls in older adults because they directly block peripheral vasoconstriction, the very mechanism your body needs to stay upright. What to do? Request a full medication review from your doctor or pharmacist. Ask specifically, Do any of my medications lower blood pressure when I stand up? The goal is deprescribing where possible, reducing doses, or switching to safer alternatives. Never stop medications on your own, but do have this conversation. It could be the most important medical appointment of your year. Knowing which of your medications are contributing to the problem gives you and your doctor the power to fix it. But the dangers don't stop there. Habit 4. Your nervous system is losing the battle against gravity. This cause goes deeper than lifestyle or medication. It sits at the very core of how your body is wired. We're talking about the baroreceptor reflex, the body's automatic blood pressure regulation system. Your body has an extraordinarily sophisticated system for managing blood pressure. Every time you stand, sensors in your arteries, called baroreceptors, detect the gravitational pull on your blood and instantly signal your heart and blood vessels to compensate. In a healthy younger adult, this all happens within seconds. After 60, this system ages. The baroreceptors themselves become less sensitive. The signals travel more slowly. And the autonomic nervous system, the part that runs all of this automatically, loses its precision. The result is a response that is delayed, weakened, or incomplete. According to StatPearls via the NCBI, when you stand, gravity pulls 500 to 1,000 ml of blood, up to a liter, into your lower limbs. Normally, your baroreceptors instantly respond by increasing heart rate and tightening blood vessels. When that reflex is compromised by age, this redistribution of blood goes uncorrected. The brain is temporarily starved of oxygenated blood, and dizziness follows. D scenario: picture pulling yourself up from your garden chair after 20 minutes of resting in the sun. Within 2 seconds, the world dims at the edges. Your legs feel suddenly heavy. You are not sick. You are not having a heart attack. But your autonomic system just failed to compensate fast enough for the simple act of standing. According to the AAFP, hospital admissions related to orthostatic hypotension reached 233 per 100,000 people in adults aged 75 and older, a dramatic surge from just 36 per 100,000 in the general adult population. This is what age-related autonomic decline looks like in real numbers. What to do? Practice physical countermaneuvers before you stand, cross your legs, tighten your calf muscles, and flex your thighs. This manually pushes blood back up toward the heart before gravity gets the chance to pull it down. Use compression stockings, 30-40 mm Hg, waist high, to prevent venous pooling in the legs. And always rise in stages. Sit on the bed edge for 1 full minute before standing. You can train your body and use physical tools to compensate for what your nervous system has lost. This is not helplessness. This is adaptability. But the dangers don't stop there. Habit 3. Your neck and shoulder pain is actually a blood pressure warning. This one surprises almost everyone. Aching neck, shoulder, or upper back pain that appears when you're upright and disappears when you lie down. Most people reach for a pain reliever. But this symptom has a name, and it is a direct signal from your cardiovascular system. Neck and shoulder tension is incredibly common after 60. Poor posture, old injuries, arthritis. There are many reasons for it, so it is completely understandable if you've never connected it to your blood pressure. The symptom is called coat hanger syndrome. It describes a dull, cramping ache that follows the distribution of the trapezius and paracervical muscles, running from the base of the skull, across the shoulders, and down the upper back, in the exact shape of a coat hanger. And it is caused by muscular ischemia, insufficient blood flow to the muscles that keep your head upright. When orthostatic hypotension strikes, it reduces perfusion to the upper body. The trapezius muscles are anti-gravity muscles, working constantly while you're upright. When blood flow is compromised, these muscles accumulate lactic acid and become ischemic, oxygen-deprived. The ache that follows is not arthritis. It is your blood pressure telling you it cannot sustain adequate circulation to your upper body. You stand up from the sofa to make a cup of tea. Within minutes, a dull, heavy ache settles across your upper shoulders and neck. You rub at it, stretch, maybe take a paracetamol. Then you sit back down and within moments, the ache begins to ease. That is not a coincidence. That is coat hanger syndrome resolving the moment gravity is no longer pulling blood away from your upper body. According to research published via the EDS clinic and specialist autonomic dysfunction literature, coat hanger pain is reported by up to 93% of patients with diagnosed autonomic dysfunction. It is one of the most reliable clinical indicators of hemodynamic instability and one of the most overlooked. What to do? Keep a simple symptom diary. Note when the neck and shoulder ache appears and disappears. If it reliably comes on when upright and eases when you lie down, report this pattern to your doctor and specifically use the term coat hanger syndrome. This is a critical diagnostic clue that should prompt a formal blood pressure assessment. Identifying this symptom correctly is one of the most empowering things you can do. You are not just managing discomfort, you are tracking a key signal from your cardiovascular system. But the dangers don't stop there. Habit 2. This is the most dangerous one. It's silently damaging your brain. Treating your dizzy spells as normal, accepting them as just part of getting older, living with them without ever investigating why they're happening. We understand why people do this. When something has been happening for months or years, it starts to feel inevitable. You tell yourself, I'm just getting older. It seems dramatic to go to the doctor about a little dizziness when you stand up. The medical system is busy. You don't want to make a fuss. But here is what the science is telling us, clearly, repeatedly, and urgently. Untreated orthostatic hypotension is not benign. It is an active, ongoing process of damage to your brain, and it may be dramatically accelerating cognitive decline right now. Every time your blood pressure drops when you stand, your brain is briefly underperfused, starved of oxygenated blood. Repeated over months and years, this creates what researchers call watershed ischemia, microscopic damage to the most vulnerable areas of brain tissue. It also drives the formation of white matter hyperintensities, small lesions in the brain's white matter that show up on MRI scans and are strong independent predictors of cognitive decline and stroke. You get up from your desk, feel briefly dizzy, steady yourself, and move on. It lasted 3 seconds. You forgot about it by the time you reached the kitchen. But inside your brain, that 3-second drop in perfusion was another small, silent assault on the blood vessels feeding your white matter. This has been happening, perhaps many times a day, for years. The evidence is now overwhelming. In the landmark Atherosclerosis Risk in Communities (ARIC) study, published in PLOS Medicine and reported by Alzheimer's Research UK, orthostatic hypotension at baseline was associated with a 15% to 40% increased risk of dementia over a follow-up period of 20 to 25 years. That is not a marginal finding. That is a major, long-term consequence of a symptom most people dismiss entirely. Furthermore, orthostatic hypotension is an independent predictor of new-onset heart failure. Hazard ratio 1.24 in community-dwelling older adults, per PMC 2014, and is associated with increased risk of ischemic stroke, myocardial infarction, and atrial fibrillation. What to do? Stop normalizing this symptom. Bring it to your doctor with specifics. When it happens, how often, what medications you take, whether you have neck or shoulder pain that comes and goes. Request a formal orthostatic vital signs assessment, blood pressure measured after 5 minutes lying flat, then at 1 minute and 3 minutes of standing. This takes less than 10 minutes and can change the trajectory of your health. Identifying this now, while there is time to intervene, is not just about reducing dizziness. It is about protecting your mind, your independence, and your future. And that brings us to habit 1. The one simple change that could reset everything. Habit 1. You're not using the single most powerful fix available to you right now. not moving in stages when you transition from lying or sitting to standing. This sounds almost too simple to matter. It is not. Standing up is something you do dozens of times a day. It is completely automatic. You don't think about it. And why would you? You've been doing it your entire life without any kind of strategy. But that automatic movement, going from horizontal to fully upright in 2 or 3 seconds, is exactly what your aging cardiovascular system is struggling to keep up with. The good news is that this single behavioral change, slowing down that transition, is one of the most evidence-supported non-pharmacological interventions for orthostatic hypotension recommended by the AAFP, the Cleveland Clinic, and autonomic specialists worldwide. When you stand in stages, you give your baroreceptors the time they need to fire correctly. Your heart rate has time to increase. Your peripheral blood vessels have time to constrict. By the time you are fully upright, the compensatory response is already underway instead of playing catch-up. Tomorrow morning before you get out of bed, try this. Lie still for 1 minute, then roll to your side and sit up slowly. Sit on the edge of the bed, wiggle your toes, tighten your calf muscles, take 3 deep breaths. Place your hands on the mattress beside you and push yourself up slowly. Stand still, holding the bed frame. Wait 10 seconds before you take your first step. Notice the difference. According to comprehensive management guidelines from the AAFP and PMC's 2021 review of orthostatic hypotension in older people, staged movements combined with physical countermaneuvers, leg crossing, calf tensing, are classified as first-line interventions, recommended before any pharmacological treatment even enters the conversation. Here is the complete action plan your body needs. 1. Staged rising. Always sit before you stand. Always pause before you walk. 2. Hydration. 2 to 2.5 liters daily. 500 ml water bolus each morning before standing. 3. Salt intake. 6-9 grams daily if not contraindicated by heart failure. This retains fluid and supports blood volume. 4. Compression. Waist-high compression stockings, 30-40 mmHg, to prevent venous pooling. 5. Smaller meals. 5-6 small, low-carbohydrate meals to prevent postprandial hypertension. 6. Elevate head of bed. Raise the head of your bed 10-30 degrees to reduce nocturnal fluid shifts and morning blood pressure crashes. 7. Medication review. Have your doctor review every drug you take and ask specifically about orthostatic effects. 8. Formal assessment. Request orthostatic vital signs measurement at your next appointment. You now know more about this condition than most people who have lived with it for years. The dizziness you feel when you stand is not just an inconvenience, and it is not inevitable. It is a signal from your baroreceptors, from your blood vessels, from your brain. And now you know how to answer it. So let's quickly recap what we covered today. 7 causes of orthostatic dizziness you must stop ignoring. Dehydration, postprandial hypotension, medication side effects, baroreceptor decline, coat hanger syndrome, the silent brain damage of untreated OH, and the simple staged movement fix that can begin protecting you tomorrow morning. The research is clear. The strategies are proven, and the power to change your trajectory is, right now, in your hands. If this video helped you or someone you love, please hit that like button and share it. You could be handing someone a warning they didn't know they needed. And subscribe so you don't miss what comes next. Drop a comment below. Have you been experiencing this? What did you think was causing it? We read every single one. Stay safe, stay upright, and we'll see you in the next one.